Members, we have formed a quorum, and it's still already the time to start. So let's get started and invite the officials to join us now. This is a special meeting in the light of the two recent cases of invasive pneumococcal disease causing the deaths of two youngsters. Dr. Ko wrote to us on Sunday to arrange this special meeting. Thank you, members, for making time to attend this meeting. The background information and the paper from the administration have been sent to members. So let's wait until we have the secretary with us.
Good
morning, Secretary. Good morning, Dr. Leung. Please be seated, and then I'll give the floor to the Secretary for an introduction to the government paper. Thank you. Chairman, regarding this incident, it's a matter of much discussion in the community, and it's about professional matters. So we have tried to compile some background information in the hopes that it will be helpful to members. So let me take some time to introduce the information. This is about pneumococcal disease and also the vaccination program concerning the 13-valent pneumococcal conjugate vaccine, or PCV13. Well, pneumococcal infection is caused by a type of bacteria which can be spread through droplets. That's why we have stressed that our people should wash hands or wear face masks if they are not well, and also pay attention to personal hygiene. Well, this is an effective way to stop the transmission of this disease. And also at the same time, we're not talking about infection caused by one particular bacteria or one particular of agent. The preventive measures that we have advocated would stop the spread of all these communicable diseases. There are more than 19 serotypes of pneumococci which can all cause invasive pneumococcal disease, or IPD. It's called invasive because in serious cases it can cause meningitis and septicemia. Serotype 3 is a more serious strain of the bacteria. Usually it can be treated with antibiotics. But if the bacteria is resistant to certain antibiotics, then things become rather complicated. But of course, doctors have recourse to different types of antibiotics, and we have set up a monitoring network to monitor the type of the serotype involved in causing IPDs. Vaccination is one of the ways to prevent IPD. The vaccines are generally effective, but the protection is not 100%, and is certainly not permanent in terms of protection. And protection against different serotypes vary. Children are a vulnerable group. Newborn babies will get vaccination in hospitals or maternity and child care center. There were 7-valent or 10-valent vaccination. before the 5th of December 2011, and after that is 13-valent vaccination instead. The vaccines cover different numbers of stereotypes of pneumococcus. In view of the number of IPD cases, there's no consistent trend of rising numbers. Annually speaking, it's 14 to 20 cases per year with 2 to 3 deaths, or 3 to 4 deaths, most of them under the age of 3. And that is they have at least got one PCV vaccination for those who are under the age of 3. There were 2 recent cases of IPD cases which has caused public concern because of both the fatalities. The Scientific Committee on Vaccine Preventable Diseases and its working group convened a joint meeting to review the relevant information and literature internationally. They come to the conclusion that there's no need to ask those who have received PCV7 or PCV10 to get a booster PCV13 vaccination now. We have noted the advice from the SCVPD and also the public concern. We have come to the decision that we would give a subsidy to those who have never been given any PCV13 vaccinations to do so with a revaccination subsidy scheme. We'll provide subsidy for eligible children to go to doctors who participate in the scheme. We'll provide the vaccine and also $50 injection fee to each participating doctor. But the doctor may charge additional consultation fees. The information will be uploaded in D of H website and also in the individual clinics. For those who go to government clinics who are chronically ill or who are from the families of a limited income, the vaccination PCV13 booster vaccines will be provided free to these children. I have to stress that the subsidy is provided to reduce the financial burden on parents whose children would like to get a PCV vaccination. But there's no rush. There's no need for parents to rush to get the PCV13 vaccination. As I've said, personal hygiene remains the most important factor in preventing IPD. Because if a patient is affected by influenza flu and then also by IPD, the consequences can be very serious. That's why we have advised the public to get vaccinated against seasonal flu. Next, on the question of booster vaccination, Dr. Leung Ting Hong of the Center on Health Protection convened a press conference last week to announce the details. If I may, I would like Dr. Leung to repeat those details. Dr. Leung? Well, we are going to introduce in phases the PCV13 booster vaccination program. The program will cover those who are from age 2 to 5 who have never received PCV vaccination. They will be eligible for 1 booster dose of PCV13 starting from today in our D of H pediatric clinics. For those children who have come back for consultation who are vulnerable because of chronic diseases and other vulnerable reasons. For example, they have previously been infected with come down with IPD, and those with immunodeficiencies such as cancer patients, those with chronic diseases of the heart, of the lung, and so on and so forth. And also to help those with limited financial means, our maternity and child care centers would provide the vaccination to eligible children, PCV vaccination. Those who can produce a certificate of financial needs, and other children would or should approach private doctors who participate in the scheme for the same PCV-13 vaccination. The list of the participating private doctors, as the Secretary has said, will be uploaded to our website. And also, at the clinic concerned, there will be prize poster displayed for the vaccination. We have sufficient supplies of vaccines. We believe there are about 150,000 children aged 2 to under 5-year-old. We have 50,000 doses in the market, and the manufacturer would shortly ship another 100,000 doses to Hong Kong. So there will be sufficient supply for vaccination of children in that age group in Hong Kong. That's all from me, Chairman. The floor is now open for members. We have sufficient time, so every member will be given 4 minutes. Dr. N. Jiang, Dr. Kwok Ka-Kay, and other members. Dr. N. Jiang first. Thank you, Chairman. I have a few questions. First, at the present moment, how many children, how many cases of these patients are now in hospital, are now hospitalized? How many patients are in hospitals? How many of them are in critical conditions? According to the paper, pneumococcus tend to affect young children and elderly people. So would you consider doing something to help low-income people or the elderly who are on CSSA? Would you provide vaccination to these people?
My third question is, now I have received some requests for help from residents. They are not CSSA families. So if they go to the clinic for vaccination, each will cost over $1,000. And in some districts, there is no such clinic available. So under the We Care Fund, will there be some emergency financial assistance for these low-income children and low-income earners? Thank you, Secretary. Chairman, on Ms. Tiang's last question, now we are offering this assistance scheme because we would like to offer the PCV-13 vaccination to these families, and this is the reason why we would like to offer assistance to them. We don't need to identify other channels, including the CCF, because if parents decide that vaccination should be offered to their children, now that will include low-income earners, as stated by Ms. Tiang, but then they are not on CSSA. They will also be covered by the private doctor vaccination scheme. But I'm sure that another matter will arise. Now, some parents would like their children to get vaccination right away. We have explained many times that they do not need to do this on an urgency basis immediately, because in the coming 2 to 3 weeks, our vaccination scheme will start. They only need to pay attention to information from us and also our website. Then they will know which doctors will participate in the scheme. The cost of the vaccination will be subsidized by the government. They don't need to pay. We will subsidize $50 vaccination fee. And as regards the doctor's consultation fee, all the information will be set out on the website, as Dr. Leung said. So this point doesn't have to be considered. What about elderly? Now, in fact, this issue is about children having received vaccination of PCV 7 and 10. And in 2 cases, they have got these vaccinations, but then, well, they have got the infection that is not covered by 7 and 10 valent. So in other words, we are offering this booster dose of PCV 13 for children. For elderly, all along there is a vaccination subsidy scheme available. I think Dr. Leung can supplement with other information. Thank you for the question. In Hong Kong and in other parts of the world, there are vaccination schemes to protect the highly vulnerable groups. 2 years old or below children and 65 years old or above elderly are the targets. And in maternal child care home, we do have a children vaccination scheme. So children below 2 can regularly go to these maternal care home, and then they can get vaccination. For the elderly, there is another vaccination subsidy scheme offering vaccination. Another point is, based on information we have, there are 7 patients which are actually pneumonia cases because of the invasive pneumococcal disease, and they are still in the hospital. Next, Dr. K.K. Kwok, Chairman. I think the administration does have its reasons behind its arrangement, but for the public, the impression is that information is confusing. Let me make 2 points. The expert panel said that the vaccine only can last for 6 to 12 months. And I have some experience. When I visited the districts, some members brought their children to me. They said that half a year ago or 1 year ago, vaccination was received by their children. So does that mean that the vaccine was no longer valid? So should there be another dose? So 2 months, 4 months, 6 months, 12 months. After 12 months, if the vaccine is no longer effective after 6 months or 12 months, then those children below 5 won't get enough protection. There are some reports saying that the vaccination may not be effective. We're now talking about PCV 13, and still there is the stereotype 3 infection cases. The expert panel also said that the vaccination may not be completely effective. A week ago, different experts made different comments. 2 days ago, Yuen Kwok Yung gave another different view. So now different experts made different comments. Should the administration announce some details, including discussions in the expert panel, stating the reasons why vaccination was not given? If the government only states its view without any scientific explanation, then the public and parents won't know what to do. Many parents would like to get vaccination as soon as possible. Now the HA is helping those chronically ill, and for CSSA families, then they can get vaccination at maternal and child care home and also other government institutions. But many members of the public would also would like to get vaccination as soon as possible. In the past, for instance, Saturdays, Sundays, and other opening hours are sometimes slots where people can get help. Some medical professionals are willing to take up voluntary work, and then also the AMS had also offered such service. So you have made arrangement for CSSA families. Those who are not on CSSA may say that they are being prejudiced against or discriminated against. Some parents opt for their family doctors, that's their choice. But some people would like to get vaccination at government clinic and maternal and child care homes. So can there be special arrangement made? Thank you, Chairman. Concerning scientific evidence, I do understand that it is difficult to explain things very clearly to the public by giving only one or two explanations. Let me try to explain again. Different experts may have read different literature and they have come up to their own judgment. And the government may not be able to consolidate different experts' views into one consensus. We must admit and respect this fact. Some experts said that the vaccination cannot offer enough protection. They only look at one consequence, and that is after getting vaccination, there are still patients being infected by the serotype 3. In fact, for those patients being affected by serotype 3, some of them have already got PCV13. Yes, it's difficult to ask for 100% protection by any vaccine. Some experts cited different data. In some studies, after vaccination, they look at the children's serum reaction and see whether there is antibodies. And I would say that this is an interim indicator. That's not an outcome indicator. Some experts said that 60% of children showed serum reaction. In that case, you may say that there is the protection because antibodies are created. But scientifically speaking, this is not an outcome. It is just an intermediate indicator. So different experts have different views in dealing with these different indicators. So as a result, this may be one of the reasons why experts have different views. That's one of the reasons. So we must admit this point, and we must understand that we cannot force the experts to give the same comment. And because of this reason, we understand that within a short period of time, it is not possible to unite experts' views. So that's why we have made a decision. We have paid respect to the panel's views. In the public health perspective, the effectiveness of the vaccination is not such that all children in the appropriate age bracket must get the PCV13 vaccination. So we are not using the government vaccination scheme to directly make this arrangement. Instead, by subsidizing those parents who have decided to get the PCV13 vaccine, booster vaccine for their children, well, they can get it in private clinics. We have to do some work to make sure that there is enough supply of the vaccine. At the same time, the media have said that the private doctors have shown different reactions. Some are not willing to participate in the scheme and some are willing to do it. The Health Protection Center needs some time to understand which doctors will participate and which won't, and also what their fees are. As explained earlier, the doctors will not vaccinate right away after seeing a patient. The doctor has the responsibility to understand the patient and the medical history of the patient. The doctor has to explain scientific information to the parents to help them make a decision. So when doctors see different patients, they will have to do different work. In that case, they may charge additional consultation fee. So we have to coordinate such work. Now, the Health Protection Center is of the view that we need 2 to 3 weeks more time to start the scheme. Under those circumstances, if we are able to start this vaccination scheme earlier, we will do it definitely. I'm sure Dr. Leung will agree with me. We understand that parents are very anxious during this period, but our responsibility is that we have to explain things further to parents. Even if experts have different views, I think experts have consistent views that this is not an emergency vaccination scheme. So, members, I hope you will understand, and I hope the public will also understand. What about the clinics? Oh, you have spent 9 minutes already. Next, Mr. Poon Siu King. Thank you, Chairman. Just now, the Secretary said that this should be done as soon as possible. I support this.
According to experts, the peak season of infection is winter. We should learn from this experience. And that is before the next winter next year, we should do something in advance, because it takes 6 months for the vaccine to be effective. So we need to deploy resources in good time. I've learned from the press that experts have different views. And in some schools, more than 20 students came down with the disease. And some experts are saying that this kind of IPD should be made reportable. Apart from prevention, treatment is important. It's unfortunate that we have a few cases of child deaths. Parents are concerned because of these fatal cases. Some of these patients will go to government hospitals, some to private hospitals. In the past, the total number was something like 150, and among them, 10 odd would be for children. Are you going to ask one particular hospital to be the focal point to treat such cases? Secretary, let me first of all deal with one of the points made by Mr. Poon, and that is the booster vaccination. It's unlike those who have already given PCV7 or PCV10. And there's the concern that the previous vaccination might lose its effect after 6 or 12 months. According to Dr. Leung of CHP, there's no evidence that you need to get another PCV vaccination after some time, or giving you a second vaccination will be effective. So we're not suggesting that those who have already received PCV vaccination to get revaccination after, say, 12 months. There's no such issue on our hand. As for asking or designating a particular hospital to deal with these cases, well, these cases can be found in various places of the community. For the time being, HA doesn't think that we should designate a particular hospital for all the cases. For those who have come down with serious conditions, I think for clinical treatment, it would be better that the patient remain in the same hospital, i.e. in the ICU of the hospital. I'll ask Dr. Leung to supplement. Dr. Leung, thank you, Mr. Poon. Let me supplement what the Secretary has said. One vaccination is sufficient. For those who are under 2, they have already got a regular government vaccination in our MCH. They already got vaccinated at 12, 4, 6, and 12 months of age. There are 3 vaccinations and 1 booster, and those would provide comprehensive protection. Why do they need to have a booster for young children? Because their immune system is not yet well developed. But at the age of 2, the immune system is already well developed. So internationally, the practice is to have 1 vaccination, and the immunity system also has a memory system that would offer protection. As for this vaccination to cover those who have not been vaccinated, is a one-off scheme. This is for those between the age of 2 to 5. We want to cover the more vulnerable children. The other question is whether this disease should be made reportable, make a reportable, communicable disease. We have no such plan for the time being. First of all, we have a very effective lab monitoring system. All confirmed cases coming from private and public hospitals will be collected. Under this system, we would get a very good knowledge about the serotypes concerned and also the drug resistance involved. We'll look at whether it's important to our public health system, whether it would lead to large-scale outbreaks, and also experience internationally and the advice from the WHO before we decide whether it should be covered in our reportable diseases system. At present, we don't think there's a case to do so. The member also referred to a recent outbreak of 20 cases. But that's an outbreak of seasonal flu cases in a particular school, not IPD. Ms. Alice Mack, I want to get some information first. After the problem with pneumococcal was reported, some family members of mine asked if they had to be vaccinated. I said no, just wash your hands and face more frequently, and that would be okay. That's what I said. But now the government provides subsidy. They are scared because they think this is what government wants. I know you want to provide subsidy to children, and you want to assure the parents that vaccines will be available. But the message is that this is mandatory. This must be done because that's what the government is encouraging or is telling people to do. Starting from today, that is the 2nd of December, some will be eligible at once, and some would wait until the latter half of the month to assure members to make parents not too worried about this. Please shorten the gap between the two starting dates, so the parents will not be concerned why they are not eligible, while some others are eligible now. We have different experts, but there's a common point about their opinion. That is, if the patient is also down with flu, and then they have this disease, the complications will be more serious. Some years ago, parents were very eager to get their children vaccinated against seasonal flu. It's not done as much nowadays. So perhaps the government should do something to tell them to vaccinate against seasonal flu, or at least ask them to wash their face and their hands more frequently. This is a question about information dissemination. I don't want to repeat the rationale that I've just cited. Well, this is a question of making a balance, and also the fact that people may be worried if they receive or they interpret the information wrongly. It's not that if you don't have PCV13, you are particularly vulnerable, or if you have received PCV13, you are not vulnerable at all. Well, there are different opinions about the effectiveness. As for shortening the gap between the two starting days, we have already done what we can do. For seasonal flu vaccination, we have been using government APIs to publicize the advice. We have also been telling people to maintain hygienic habits such as washing hands, and there are also other publicity measures. Last month, there was a press conference. I myself and colleagues in the healthcare system took the lead in getting the seasonal flu vaccinations. We'll make use of various channels to conduct public education. Ms. Elizabeth Quart, the development of this communicable disease is worrying the public. And Dr. Koh and the administration did act very quickly to address the concerns. But as some other members have said, the information is confusing. Many parents are still worried. Dr. Koh keeps saying that parents don't have to worry. There are sufficient vaccines for those who need them. And also you are providing a subsidy to needy families, and there's no need to rush. Well, having heard that, parents are still worried because there's always the likelihood of getting the disease. And if they're not supposed to rush to do it now, then when? So the mentality is that the quicker the better, or else the children may come down with it tomorrow. So maybe Dr. Cole, I'm no expert, maybe Dr. Cole can adopt a better approach to tell the children. You tell them not to rush. So when should it be done? And also I want to talk about the vaccines, seasonal flu vaccines. Since a combination of seasonal flu and IPD can lead to serious complications. So what should parents do? If they haven't got a seasonal flu vaccination this year, should they do it now? Because it takes time for the vaccine to be effective. We have been asked these questions from parents, and we don't have no answers. I hope to get some answers from you. Chairman, I don't think we can tell people that before a certain date or within a certain period of time, you must get the vaccination. In our publicity, public education on seasonal flu vaccination, we can never tell people that you must do this within a day or 2 weeks or 1 week. As I've explained, for PCV13 vaccines, there's no need to seek urgent vaccination for your children. But this is the formal message. Different experts may give you different views concerning the extent of protection afforded by the vaccine and whether you need a booster vaccination. The experts all say that there's no need to do this urgently. Let me repeat. In our Center for Health Protection, we are doing preparation in earnest, and within 2 to 3 weeks, we'll be able to launch the vaccination subsidy scheme. And people should wait until the scheme is launched. Although we will not stop parents from getting vaccination from private doctors earlier than that. As for seasonal flu vaccination, winter has just started. It's traditionally the flu season. It can last until February or March. Therefore, in my view, it's not late now to get seasonal flu vaccination.
So if some parents would like to get 2 vaccinations on one occasion, on the same occasion, is that okay? Now, for 2 vaccinations, if we talk about flu vaccination and the pneumococcus vaccination, well, they can be done together. There is no need to have a time interval between the 2 vaccinations. And if you have vaccinations on the same day at the same time, one on the right arm, the other on the left arm, that is also okay. Next, Mr. Leung Ting Kwong. Thank you, Chairman. I'm not a doctor. I don't have professional knowledge. Now, if the pneumococcus is infected, will this become an epidemic? Will there be this trend? Many parents are worried that there may be infection. So when the government announced about this vaccination, in the past, I didn't even know what is meant by all these valents, different valents. So people are very anxious to have their children vaccinated. Whatever the experts have to say, their remarks are less powerful than the media reports. So I think it is important to have positive publicity reports. That is most important. Concerning prevention against pneumococcal infection, apart from vaccination, Is there other effective ways? Just now, the secretary and the doctors mentioned frequent cleaning of hands, or there must be good ventilation. We should avoid going to crowded places, and there may be some dietary habits. I think all these can be publicized so that people will not only focus on PCV 13. Will that be better? Secretary, I would like to respond to 2 points. As regards whether pneumococcus will become an epidemic, I think I would defer to my colleague. Mr. Leung said that there are now so many different views, so can the government offer more effective way? I dare not say that I have a more effective method. But the most important principle is to achieve transparency of information. Different experts have different views. There's no way for us to hide all these views. That is not right. We just want to make sure that there is transparency of information. I am offering explanations almost every day. In the Hong Kong society, I think transparency of information is the best way to deal with different views and confusion of information. I cannot really think of a better solution. As regards consensus, I would like to take this opportunity to point out that experts have different views about this PCV 13 booster vaccine. But a strong consensus is for flu vaccination. I think members of the public, I hope that they can receive this information effectively. Dr. Leung, thank you, Chairman. Thank you, Dr. Koh. Thank you, Mr. Leung, for your question. I think in terms of the incidence rate, Hong Kong is among the lowest in the world. There has not been much difference in terms of the popularity of this infection. For people below 5 years old, if you talk about this invasive pneumococcal disease, there are 14 to 21 cases. And this year, there are 15 cases, and in the year before last year, 21 cases. We're still lower this year. We're talking about people below 5 years old. You may be more concerned about serotype 3 cases. In the past few years, there are 3 to 8 cases. So I think this is a low digit, a low number. So I think parents should understand that Hong Kong is a low-risk place. Of course, the vaccines can reduce risk. There are over 90 serotypes of pneumococcus. There are not 90 odd vaccines. In the past, there was a valent 7 and then later on valent 10, and now we have valent 13, which can protect people against more serotypes. So we do not only need to rely on vaccines. As Mr. Wong said, our experts are of the view that the most important thing is to pay attention to personal hygiene, wash hands frequently, and avoid going to too crowded places. So people should exercise and should have enough sleep so that we will have stronger immune system, and this can lower the possibility of getting infected. Next, Dr. Fernando Zhang. Thank you, Chairman. we are talking about whether we should get PCV13 booster vaccines, and some private doctors are talking about 23, valent 23 vaccine. So 7, 10, 13, and then 23. On the surface, perhaps valent 23 is better than 13. So we don't know whether we should get vaccination, and we don't know which valent vaccine should we receive. Now, I think the Department of Health and the HCP should offer more accurate information to the public. I have some friends who approached the doctors. The doctor said that we are now working with valent 23, not 13. So people are of the view that the government is always more backward than the market. The market is always faster. So we should get PCV 23 rather. So can you please answer this point first? I have still some more questions. Secretary, 13 or 23? Chairman, thank you, Dr. Zhang. PCV 23 is an older vaccine. The function is different from PCV 13. For children below 5 years old, they should get PCV 13 because that is better in stimulating the immune system of children. So the protective effect is better. So in the whole world, children below 5 years old should get PCV 13. What about PCV 23? The function is that if a person has some special illnesses, for example, in elderly people, they need more protection. The protective capacity is lower in relation to certain serotypes. If there are problems with a person's immune system, then PCV 23 will be administered in order to have a wider coverage. We are concerned about serotype 3, and PCV 13 is better. So all along, in other parts of the world, PCV 13 is given to children. Chairman, I suggest that the Department of Health or the Health Protection Center should prepare a leaflet setting out all the information about these different vaccines. And these leaflets should be distributed to places like kindergartens, nurseries, maternal and childcare centers frequented by parents and children, so that people are more aware of the situation. Many private doctors talk about PCV 23, giving people the impression that it's more advanced. Now, the Bureau is saying that experts have different views, and your expert panel is of the view that the booster vaccine may not be effective, but still you are giving subsidy for the booster vaccines. So what kind of message would you like to give the public? Are you saying that booster vaccine may or may not be useful? But if you are still worried, we do have this scheme. Or are you saying that the booster vaccines are useful, so we want to encourage people to get it? Or you are saying that booster vaccine is not useful, but we are worried that we'll be criticized, so we offer the scheme, but you don't need to come. Which message are you trying to give? Chairman, let me respond to the point on how to improve publicity. We have got a website setting out all the frequent Q&As, so parents don't need to read any leaflet. We have a hotline 2125-2125, on which we can answer parents' questions. And within a short period of time, we will organize a seminar giving the latest information. And recently, we sent 2 letters to all doctors in Hong Kong, giving them the latest information. Yesterday, a seminar took place already. And in the future, we will organize one more seminar for all doctors in Hong Kong. Chairman, I would like to supplement. Dr. Zhang just asked whether or not the booster vaccines are useful, and he talked about 3 scenarios. In the past few days, there are different assessments of PCV13, but there is no expert saying that PCV13 is not useful, useless. It's just that the experts are of the view that PCV13 is not highly effective. So in the public health perspective, it is not recommended that the government should ask all children to get PCV13 booster vaccines. There are 2 considerations regarding vaccination. 1, protection of the individual, and 2, in terms of public health, we hope that if most people are vaccinated, then there will be a crowd immunity, then there will be less chance that there will be an outbreak of this disease in the community. So apart from personal protection, we have to consider how big the protection is and whether it is worthwhile to incorporate it into a regular vaccination scheme from public health point of view to reduce the possibility of community outbreak. So if you want a yes or no answer, I will say that it is not really possible to achieve that. But as regards the vaccination, the experts are of the view that it is not as effective such that we have to incorporate it into a regular vaccination scheme. But there is not an expert saying that this vaccine is useless. Okay, next, Miss Wang Pick One.
主席，即剛才居生話冇一個專家話。
Well, Dr. Ko says no expert is saying that the PCV13 is useless. And it's not sure whether the PCV13 vaccination would prevent or protect children so as not to cause death. We're still confused, Dr. Ko, after hearing you. According to the paper, there was a meeting, a joint meeting of the Scientific Committee on Vaccine Preventable Diseases and its working group. The previous message we received from the Scientific Committee was that the experts of the committee didn't think PCV13 should be implemented, should be required. And now you're asking those from 2 to 5 who have never received PCV13 vaccination to get one now. So was the Scientific Committee unanimous in its views among the experts? Or was that a majority view of experts? And what about the working group? Was there a consensus of the working group? There's no need to have this vaccination. And if is there a difference of opinion between the Scientific Committee and the working group? I think the parents would like to get a very clear-cut answer, yes or no vaccination or no vaccination. Other people may also like to know the factors that one needs to consider in going for vaccination or not. I think we should give parents a clear message so that they can make an informed decision. If it's useless, or it may be a waste of money, or it may be counterproductive, well, the worst scenario will be that vaccination ends up making it worse. So we should let the parents know so that the parents can make a decision themselves. Chairman, if you allow me to say this, I would like to give an elaboration of the rationale, although I will be repeating myself. Dr. Wong is asking us to tell the public whether the people should or should not get vaccinated, or whether it's useless or not useful. Whether it's useful or not useful. I cannot give you a clear-cut answer. As I have explained, the scientific committee is of the view that PCV13, well, let me stress again, we're not talking about two different bodies arguing between them. I'm talking about joint meeting. The expert members assess the protective power of PCV13, and it's considered that the protection is not so strong that it should be covered by a regular government vaccination program. Therefore, they do not advise the government to get vaccination for all children. As I've stressed, there's still some protection offered by this vaccine, so as a personal health protection measure rather than a part of our public health program, which aims at protecting the community. Well, people can consider getting vaccination as a matter of personal protection. I think, as I've explained, the best approach is to go to see a doctor and get some advice from your family doctor if you consider vaccination. The doctor would know about your more about your physical conditions. The doctor will explain the pros and cons of vaccination, and then the person can make a decision. Vaccines do have side effects. For PCV13, it's not a vaccine that would they will give rise to the serious side effects, but for minor complications such as a rash or painfulness, that may still be possible. Let me offer help. I'm not trying to make it difficult for you, Secretary. A century ago, people in China talk about the need to have democracy and science, and now members are asking questions because they want to pursue science. Well, I know you need to get evidence. We know we have to treat this as a public education initiative. Some parents don't understand data, but some do. So, for example, why are some doctors advise for vaccination and some against vaccination? Say I treat colon cancer. After the patient will ask me whether chemotherapy is advised. Well, some would go for it, some will not. And so as a doctor, I have to tell the patient some data. Well, your 5-year survival rate is 70%. And if you do it, it's 73%. It's a probability. Well, I wouldn't say that if you don't do it, you're bound to die. If you do it, you are bound to survive. Well, it's a question of data and probability. There are patients who get it done and died of complications, and some who opted out, and then there was a relapse after 2 years, and they would blame me. So we can give them some data. For example, in this case, in this example, the survival rate would be different to the extent of 3 percentage points. For those who are already in their old age, they may think they shouldn't do it, but those in the 30s may think it's worth the while. And also there's the question of cost. Is it $10,000 or below? Well, do it. It's worth the while to do it. And if it's hundreds of thousands of dollars, maybe the advice should be not to do it. Before we have the PCV vaccines, say for every 100,000 children under the age of 5, 20 will come down with IPD, and with vaccination. I'm just thinking aloud. Say after vaccination, the number would come down to 5, a reduction of 75%. But it doesn't mean that with vaccination, you don't even have the 5 coming down with the disease. The experts might come up with different advice in accordance with the data. One would say that it's very good, it's down to 5. Do it. And another expert would say that it would just come down to 5. It's useless. Don't do it. Can you give us similar data as in my example? Let me say something, and then I'll ask Dr. Leung to say something as well. I thank you, Chairman, for giving this suggestion whether we would be able to give people some data of that nature. But I have to point out that there are some constraints as to what we can do. In a low incidence situation, the yearly fluctuations, even when there's no major reason, the introduction of new vaccines and so on and so forth, the data themselves fluctuate, and they fluctuate to an extent that people's judgment when they see the data will be affected. If you want to have a comprehensive set of data, well, then your suggestion is certainly the correct approach. But as Dr. Leung has said, Hong Kong is a territory with a low incidence rate. We're talking about 10 to 20 cases a year. And even with no vaccination, it can be 14 this year, 20 next year, 17 the year after that. So can we attribute the fluctuation to vaccination or not? Well, it's not scientifically valid. Of course, the data can provide reference, but making judgment on that basis is problematic. As I've explained, in any study on the effectiveness of vaccines, actually there are 2 ways to look at it. One, you look at what happens after vaccination. You compare those who got vaccinated, and then you compare these to those without vaccination, and what's the difference of the incidence rate. That's the comparison of different outcomes. But sometimes the vaccine is introduced only for a short time. There may not be sufficient data. So the experts would make reference to those who have vaccinated and how many of them have reacted to the vaccine by means of antibody. According to experts, PCV-13 vaccine is in such a state, and that's we have got partial data after PCV-13 vaccination. The levels of antibody is 60 in some cases, 80 in some other cases. There's no data on the so-called actual outcome. And that's those with PCV13 booster on vaccination, what the difference in incidence is likely to be between the different groups. We can only rely on our experience in the past couple of years, and that is among the patients. Some did get a booster, some didn't, and then we can infer from the data what kind of clinical effects a booster may give you. And that's why even if we want to do what the chairman has suggested in telling people the relevant data, and that is whether the treatment would lengthen the lifespan and so on and so forth, there are still some constraints that we cannot overcome. Dr. Leung may want to supplement. Let me give some data for reference. First of all, Hong Kong has a low incident rate. We are at a much lower risk than Western countries. I'm talking about those who are under the age of 5. UK, US is for every 100,000, 80 children would come down with IPD. Hong Kong, in the same period, that is without vaccination, for every 100,000 we have 10. We have 10 cases. It's just a fraction of the number in those countries. Also, after the introduction of vaccination, we have the vaccination for a few years. In UK and US, the number dropped to under 40 for every 100,000 children in that age group. That is halved. And now the number dropped to 4. We are still 1/10 or 1/8 of the number of cases. Hong Kong is a low incident rate area. So here are the overall figure. Cases involving children under 5 from 2010 to this year, we're talking about 14 cases to 21 cases per year. This year is 26. Okay. Our time is limited. Maybe you can tell us the best available evidence. I'm not talking about the best evidence. 2 members would like to raise questions in the second round. Anyone else would like to do the same?
So you have 4 minutes each, Ms. Chiang. Thank you, Chairman. I have 2 questions. I read from the paper that there are variants 7, 10, 13, and 23. So for PCV 23, under what circumstances will it be needed? My second question is, just now, the Secretary said that this disease is being spread by droplets. Now, if we talk about ordinary cold virus, let's say if you sneeze, then within a few 10 seconds, that virus will die. And concerning the pneumococcus, how long can it survive in air? I think we have to let the public know that if it is spread by droplets, is it better for the public to wear a mask? You ask people to wash hands more frequently. Oh, perhaps if the virus will die after a few 10 seconds, then perhaps it is more effective to wear a mask. Chairman, as you know, if a person is ill, the best thing is to rest more. Now, Secretary, it seems that you are not feeling well. I think, shouldn't you take a rest as soon as possible, or shouldn't you get vaccination? Thank you, member. I will try my best to respond to your two questions, and then Dr. Leung can supplement. Regarding PCV 23, as Dr. Leung said, between the two groups of vaccines, namely PCV 23 and then 7, 10, and 13, the way how they stimulate our immune system is different. Children's immune system is not that mature. So for PCV 7, 10, 13, they are mainly for children. They will offer stronger stimulation to the immune system. For PCV 23, the design is such that it is mainly for people who are adults, especially elderly. So the design is different. For children below 5 years old, the experts do not recommend PCV 23. PCV 23 is mainly for adults, especially the elderly. Concerning spreading by droplets, we are not concerned about how long the virus will stay in the air. Usually, for spreading through droplets, the distance is 1 to 2 meters. The droplets will then stick onto certain surfaces, including the tables, the stationery, and so on. And during the SARS outbreak, for example, we also talked about the buttons on in elevators. And then when people come into contact with droplets stuck onto various surfaces, they will bring the virus to their mucus, and then they will be infected. So people who are not feeling well should put on a mask so that the droplets will not affect other people. And then secondly, people should wash their hands frequently. After coming into contact with other surfaces, your hands should not come into contact with your mucus. Next, Dr. K.K. Kwok. Chairman, just now I asked a question. I think it should be answered again. Many parents are concerned about whether there is another channel. The government is offering this flu vaccine subsidy scheme. I think this is a good choice. But usually we will give public some choices. And now, will the government offer a channel so that those who think about the public system, like the Department of Health, Maternal and Child Care Home, and the Hospital Authority or general outpatient clinics, then they can go there for vaccination, and if necessary, for example, the AMS or the voluntary medical professionals under the Department of Health and the Hospital Authority can participate. So will the government consider this? When we are waiting, there is still the need. The government offers this flu vaccine to respond to parents' requests. So if the government has the resources, why not? Secretary. Apart from CSSA recipients, and also those high-risk children getting specialist treatment, apart from these two groups, we won't consider other government channels, because based on our expert panel's view, our expert panel doesn't think that we should incorporate this vaccination in our regular vaccination scheme. And in 2 to 3 weeks' time, we can introduce the scheme. We're talking about as many as 150,000 children. So in the interim period, it is not necessary to offer an alternative arrangement. Besides, we may not be able to accommodate it. Chairman, I don't agree. In the past, AMS had helped in a vaccination scheme, and at that time it was not a regular scheme. And it will take time to discuss with other medical associations or medical groups, and not all medical groups are willing to do it. So during this period, if we talk about voluntary helpers who are not within the government organization or mechanism, why not? Chairman, I respect Dr. K.K. Kwok's view. I have already explained my point. Finally, about the data, can you give some estimates? Do you have figures about the chronically ill and those CSSA children? How many are there? The HA gave an estimate of 1,000. There isn't an exact figure because at the specialist clinic, patients have to be diagnosed by the doctors in charge to see whether they are appropriate to get the booster vaccine. Based on the HA's current estimate, there will be around 1,000 children. I'll see whether Dr. Leung can produce other data. Yes, thank you, Dr. Kwok. For CSSA families and those holding certificates on medical expense remissions, basically there are around 10,000 people. There are two straightforward questions. Before their next prearranged visit, what will you do with these children? There may be an interim period of 2 to 3 months. Besides, the private doctors can buy the vaccines. There won't be restriction. Yes, the private doctors can buy the vaccines. But for our subsidy scheme, we will arrange through our procurement contracts that the pharmaceutical companies will directly deliver the vaccines to the doctors. For children in the HA channel, let's say if the follow-up visits won't take place within this month, then what? These children have different follow-up schedules, and now the HA is identifying those people with follow-up visits later in the year, so that there will be time for them to get vaccination. You said that there is nothing to be anxious about. You said that it's okay to get vaccination like after a month. I do understand. Can you offer explanations with some figures? Some patients will ask me if he has cancer, would there be a difference between having operation now and 1 month or 2 or 3 months later? There should be some difference. I don't know whether there are the scientific data available. I think there can be some calculations. I'm not sure. But Chairman, since you have asked this, I will go back to find out some information. Now, the incidence rate is very low. I must emphasize this. The number is very stable. There's no way to work out the difference, but then the risk involved is very small. Now in Hong Kong, there is no irregularity. If you compare now with June, yes, there are no more cases. This is because of the seasonal factor. In December, January, and February, usually there are more cases every year during this period. If you compare the end of the year and the middle of the year, there are usually more cases. But we cannot really work out the risk in this way. There should be some international figures, right? Please try to find the information. Thank you, members. We have asked all our questions. Thank you, and meeting is adjourned here.